All right, hello Natasha. My name is Nurse Toko, and I'm going to be doing a thorough head-to-toe assessment of you today. If at any point in time you feel uncomfortable, please just let me know and we can stop whenever you need.
Okay.
If everything's fine with you, I'd like to get started. I'm going to start with a general assessment of your external appearance. I'm going to be assessing your skin. I'm going to be looking at the turgor. I'm going to be feeling the temperature of your skin. And I'm also going to be assessing the color of your skin for any abnormalities, bruising, discoloration, or any marks on the external skin. I'm going to get into a more focused assessment of your head. I'm going to start by palpating the scalp, feeling for any lumps, bumps, or abnormalities along the scalp. I don't feel any there. I'm going to continue the exam by doing the same palpation across your face, feeling for any lumps, bumps, abnormalities on the face. And while I'm here, I'm going to palpate the sinuses. Do you feel any pain, pressure, or discomfort when I do this?
No.
Okay, that's a good indication that you don't have sinusitis. I'm then going to assess the cranial nerves. If you could puff out your cheeks for me. All right, and then clench your teeth. Good, and then burrow your forehead. And then keep your eyes closed, and I'm going to try to open them. Good, perfect. All right, next I'm going to move into exam of your eye. I'm going to start with the surrounding structures. I'm going to examine your eyebrows, your eyelashes, your eyelid, the sclera for any signs of inflammation or bumps in the eyelids such as stye, which could be an infection. Any pain in the eyes?
No.
All right, good. Next, I'm going to be assessing your ocular movements. So you're going to keep your head still and follow this pin with your eyes only. Good. Perfect. All right. Next, you're going to tell me when my fingers come into view.
See it?
Yeah.
See it?
Okay, now you're going to cover one eye, and then you're going to tell me how many fingers you see me holding.
4, 8,
And now cover the other eye.
6, 8.
Good. Perfect. All right, next I'm going to be checking your reflexes of your pupils. You can just look ahead. Good. And then I'm going to put my hand here and observe the opposite eye. Good. Perfect. Next, I'm going to be doing a fundoscopic exam. All right. I'm going to be looking into your eye. Just look at my ear for me. And here I'm going to be assessing the retina, the optic disc, and checking for that red reflex on both eyes. Oh, that's really good. All right, next I'm going to have you look directly into the light, and I'm going to be checking the macula. Good. Sorry. Good. Perfect. All right, next I'm going to be moving on to the nose. I'm going to palpate the external nose, and I'm just going to be checking for any lumps, bumps, abnormalities. And then I'm actually going to be using my light to look inside the nose. And here I'm going to be checking the... Here I'm going to be assessing for any inflammation in the sinus or any postnasal drip or discharge coming out of the nose or any inflammation or swelling inside the nose, and it all looks fine, as well as the external nose, it's fine. I'm going to move on to the lips. I'm going to start by assessing your external lips, looking for any signs of blisters, lesions, sores, cracking, discoloration. You can open your mouth, and with your mouth open, I'm going to look at your teeth. I'm going to look at your gums. I'm going to look at your cheeks and your tongue. If you could stick your tongue out and say, ah. Good. And I'm going to look at your uvula and also assess your tonsils in the back for any signs of inflammation in the lymph nodes there. Good. If you could stick out your tongue and put it in all 4 directions and then in a circle. Perfect. Next, I'm going to assess your ears. I'm going to start with the external ears, and I'm just going to be feeling around to make sure that there's no lumps, bumps, abnormalities. And then I'm actually going to assess your internal ear, and what I'm going to be looking at here, I'm going to pull the ear up and back. I'm going to be looking at your tympanic membrane, as well as assessing for any swelling or inflammation or fluid in the ear, or swelling and inflammation in the canal. All right, and I don't see any inflammation in the canal and the tympanic membrane. Looks normal. All right, I'm gonna stand behind you and I'm gonna have you cover one ear and I'm gonna whisper something and you try to repeat what I say.
4, 3 water.
Yep, and we'll do the same on the other ear.
7, 1 dog.
Yep, perfect. All right, while I'm here, I'm just gonna quickly do a strength check. If you could push your shoulders up and I'll push them down. And then if you could lean your head to the side and I'll push it up. Good, and the other one. Good, perfect. Next, I'm gonna do a test called Weber and Renee. Let me know if you feel something.
I do.
Do you feel it more on one side, more to the other, or equally?
The same.
And do you feel any pain?
No.
Okay, I'm gonna go to the back of you and I'm gonna put this on your mastoid process. Do you feel anything?
I do.
All right, let me know when it stops.
It stopped.
All right, and do you hear anything?
I do.
And let me know when it stops.
It stopped.
Okay, and the same thing on the other side.
It stopped.
All right.
And it stopped.
All right, so here we have that air conduction is greater than bone conduction, which is normal. All right, while I have this, I'm gonna do a sensory check. So you're gonna close your eyes and tell me where you feel this, okay?
My face. My chest. Thumb. Right thumb. Left thumb. Right knee. Left knee. Right ankle. Right ankle. Left ankle. Toe. Left toe.
All right, good. Next, I'm going to go back behind you and I'm going to be assessing your back, just doing an overall general assessment first, just assessing the general appearance and also palpating for any signs of abnormalities. And then what I'm going to do is assess for CVA tenderness. Do you feel any pain there?
Nope.
Any pain there?
Nope.
All right. When you feel my hands on your back, say the number 99.
99. 99. 99. 99.
All right. And then as wide as you can, take a good deep breath for me. I'm going to be measuring chest excursion one more and seeing how far my fingers are spreading apart. Good. I'm going to percuss the borders of your lungs. Good. And then lastly, I'm going to just listen to your lungs from the back. Just take nice deep breaths whenever you feel the stethoscope on your back. Good. Perfect. Now I'm going to come over to your front and I'm going to be doing an assessment of your neck. I'm going to start by palpating the neck and I'm going to be feeling for any lymph node swelling or abnormalities in the neck, lumps, bumps. And while I'm here, I'm also going to be assessing your trachea to see if there's any deviation from midline. I'm also going to assess your thyroid to see if I see any signs of nodules, goiter, swelling, or abnormalities in the thyroid, which none is noted. I'm going to move on to your chest. I'm going to start by general palpation. I'm going to be assessing for thrills and heaves. And I'm also going to be assessing the PMI. All right, now if you could hunch your shoulders over, and then I'm going to assess for that subclavicular nodes. Good. I'm also going to be palpating the chest. And I'm looking for the borders of your lungs here. And then that same vocal fremitus, 99.
99. 99. 99. 99.
All right. And then lastly, I'm going to be listening to your heart and your lungs. I'm going to be listening to all 5 points of the heart. If you don't mind if I can be under your shirt. And then I'm going to assess it with the bell as well. And then I'm also going to be listening to your lungs. I'm trying to just nice deep breaths for me. All right. If you could lay on your left side, and I'm gonna be listening to your. Do you need a pillow on that
No,
side?
I'm
Okay.
good.
I'll listen to your mitral valve. All right, and if you could lay on your back for me. All right, now while you're here, I'm going to be assessing your neck for that carotid artery. If you could turn your neck each side, I'm gonna assess for jugular vein distension. Good. And then I'm gonna listen to your carotid artery. When you feel the stethoscope on your neck, just hold your breath. It'll only be a moment. Good, now you can catch your breath. Good. Good. And while I have you laying here, I'm going to be doing your breast exam. If you could lift up your arms first, I'm going to palpate your lymph nodes here. You feel any pain or swelling? Nope. Good. And then I'm going to do a breast exam, starting at the nipple, and I'm going to be feeling a circular bullseye motion for any lumps, bumps, or abnormalities. Any pain when I touch your breast like this? Okay, done. Next, I'm going to be assessing your abdomen. Thank you. I'm going to start by doing a visual assessment of the abdomen, just looking for any obvious signs of abnormalities or discolorations or any protrusions or pulsating masses. And then I'm going to listen to your bowel sounds. All right, then I'm going to listen to your aortic, your femoral, your femoral, your renal, and your iliac arteries. I'm also going to palpate for your femoral pulses and then feel for the inguinal nodes there. All right, I'm then going to percuss for the border of the liver. Okay, so I have an ending here. And then I'm going to do general palpations across your abdomen. I'm going to start with some light palpation. Does this elicit any pain? Let me know at any point if you feel pain. And then I'm going to move into deep palpation, and at this point I'm going to be looking for your liver, your spleen, and I'm also going to go to the back and feel for your kidneys. If you could take a deep breath in for me and then let it out. Okay, any pain there? No. All right, come to the other side. Okay, all right, next I'm going to move on to your legs. I'm just going to do a general assessment of your legs, looking at the exterior appearance, assessing your hips, your knees, your ankles, your feet. I'm going to assess the skin, temperature, color, turgor. I'm also going to be feeling for your pulses. I'll start with your popliteal, and then I'll move into your tibial, and then your pedal pulses. I'm going to be assessing for signs of edema. Do you feel pain in your legs when I do this, when I squeeze? All right, if you could push down on my feet like a gas pedal and then pull all the way up. Good. If you could open and close your toes, rotate your ankles. All right, we're going to do some range of motion. I'm going to lift your knee. Any pain when I do any of this? And then when we do this, any pain with any of that? And then we'll do the same with the other leg. Open and close your toes, rotate your ankle. We're going to lift your knee and go out and come in and go up. Perfect. If you could swing your legs over and come and sit up with me. I'm also going to be assessing your arms. We'll start with assessing just the general appearance, palpation, the hands, the wrists, the elbows, and the shoulders. I'm going to assess your radial pulses. I'm going to assess your capillary refills. Did I do cap on the toes? I'm going to do cap on the toes if I did not do cap on the toes. If you could squeeze my fingers, all right, and then push my hands back and then forward, and then close your hands and then like, yep, good. All right, and then we're gonna do range of motion. Open and close your fingers, rotate your wrists, elbows, shoulders, range of motion if you can. Good, perfect. Next, this is sharp and this is dull. So you're gonna have you close your eyes and just tell me what you feel and where you feel it, okay?
Okay.
All right.
Dull face. Sharp face. Dull face. Sharp thumb. Dull thumb. Dull knee. This is okay. Dull sharp knee. Dull ankle. Soft ankle.
Okay.
Dull. I don't know.
Good.
I don't know.
Next, I'm going to check your reflexes. I'm going to start with your knee. Ooh, I got you.
Yeah, you did.
Right here. Just give me the weight of your arm, good. And then the other arm. All right, and then your hand. And then if you could just stand up and put your knee on the bed as such. All right, and then I'm going to assess for this back ankle and the other one. Good. All right. Next, I'm going to have you sit on the bed. I'm going to have you rapidly kind of go fingers to toe. Yep, we're going to do rapid motions. And then you're going to touch your nose and then touch where my finger is. All right, if I could have you stand up. I want to make sure we're still in camera's view. And then if you could hold your arms out and then just with your eyes open. And I'm going to assess. I'm going to be here. If you lose your balance, I'm just going to be assessing for any swaying or any indication that you're losing your balance or going to fall or trying to use accessory techniques to support yourself. And then do the same thing with your eyes closed. And I'm going to reassess if you are falling or losing your balance. Perfect. And next, I'm going to have you walk back and forth just normally how you normally walk. Good. And back. Good. And then I'm going to have you walk on your tippy toes, back and forth. Good. And back. And then on your heels. Good. And back. Good. All right, next we're going to do range of motion. We're just going to go ahead and do range of motion. I hope we're still on the camera. Of the whole thing. We're just going to start from the top. We're going to do range of motion of the neck. Rotating. Range of motion, I know. Stress. Shoulders. Arms. Elbows. Good. We're going to go all the way down to our toes. And then all the way back. This is range of motion of the spine. And then side to side. And then rotation. I'm going to come behind you and I'm going to assess your spinal cord for any signs of kyphosis or scoliosis just by palpating the spine and making sure it is in alignment. Any pain when I do this? All right. And then lastly, I'm going to have you run your heel down your shin. Any problems with that? All right. Let me look at the time. 19 minutes. 10 minutes. Oh God. Okay, let me run through it. range of motion. Assess for scoliosis. Feeling the palpating. Oh, it's palpate the spine for scoliosis. And then assess the shoulders as well for height for scoliosis. Shoulder strength. Did we do strength tests? Did we do strength all the way around? Resistance. I did the eyes. I feel like there's something I missing with the eyes. No. I'm gonna say I'm done.
I think you did great.
Oh. I thank you. I'll stop the timer because I think we already kind of ate into. How do I stop it? This one?
I think that's
This one?